The next big advance in cancer treatment could be a vaccine that can shrink tumors and stop cancer from coming back. Among the targets for the experimental shots are melanoma, pancreatic cancer, breast cancer, and lung cancer. Scientists say that the research has reached a turning point, with many predicting new cancer vaccine approvals within the next 5 years. Now, these are vaccines to treat existing disease, but preventing cancer before it starts is another line of research. Now, patient volunteers are saying that they're taking part in hopes of shrinking their tumors, but also to help future cancer patients. Well, joining us now to tell us more about this promising form of cancer treatment is Dr. Stuart Edmonds, Executive Vice President of Mission, Research and Analysis at the Canadian Cancer Society. Dr. Edmonds, welcome to Forum Daily.
Hi.
So as we mentioned, cancer vaccine development is not relatively new, but the research is said to have reached a turning point. So can you tell us a little bit more about these new promising developments?
Well, you're right. The cancer vaccine development isn't necessarily new. We've had cancer vaccines, particularly in the form of prevention, for many years. We know about preventing cervical cancer with the HPV vaccine, for example. I think what's really changed is actually using cancer vaccines to actually treat cancer. And what we found, I think what the real turning point was, is during the pandemic, we all know about the messenger RNA, mRNA vaccines that really helped all of us protect ourselves against COVID. And using the same technology, messenger RNA, has really helped us really move forward in cancer treatments. And not just the actual treatment itself, it's how the messenger RNA has been delivered to the patient. I think that's probably the most significant stride we've made over the past few years. Before, we've had cancer vaccines that have been used for treatment, but they haven't been as effective as possible because they haven't got to the place where we need them to be effective that well, and so they've been cleared by the body's own systems. So now we have delivery processes where we know we're getting the messenger RNA to the right spot. Really exciting work, but very early work as well. So we're in very early phase clinical trials. There's still a relatively small number of patients that have been involved in the studies, but the idea is to really build out the number of patients involved to understand more about the positive effects, but really to try and manage some of the side effects as well.
Now, that's really interesting. We heard a lot about mRNA vaccines during the pandemic. Can you walk us through how these mRNA cancer vaccines work?
So what the mRNA vaccines are really trying to do is they're trying to really improve the effectiveness of the immune system. It's long been thought that the immune system is probably one of the best defense mechanisms against cancer. It protects us against a lot of infections, but really we haven't really thought about it in terms of how we can harness that immune system to really help us in the battle against cancer. So if the technology is such that we extract a part of a person's tumor, so tumor cells, we identify the characteristics of those tumor cells, produce messenger RNA, then put it back into the patient. So you're really getting a specific treatment that is actually then really amplifying the immune system and really triggering the immune system to respond to the cancer cells within that individual. Then there's other ways we can do this as well by actually almost supercharging the immune system so it actually responds even better than it would do before as well. So this is really about an individual approach. It's really something called precision medicine to ensure that the treatment we're giving to a patient is actually targeting that patient's own cancer cells. So it's fantastic therapy and really, really promising. But as I said, early stages still.
Very promising developments, Doctor. Now, just about a minute left here, but what does the future of cancer treatment look like, and how close are we to having widespread access to cancer vaccines, considering these promising results?
Well, as I said before, there's still some research we need to do to really understand the full effectiveness of these treatments and to really understand kind of who's going to respond to the treatment and who may not, and what the side effects may be. But these clinical trials are taking place right now, and hopefully in the next 5 to 10 years, we're going to have these treatments in the clinic, and add this to what we already have, a huge armory of treatments for cancer. I'm very optimistic that we're going to be able to prolong many lives of people with cancer right now.
Lots to look forward to. Dr. Edmonds, thank you again for joining us today.
Thank you.
All right, stay with us. When we come back, we're going to be joined by Catherine Murray, host of The Buck Stops here for Forum Daily's weekly market update. After that, we're going to be bringing you today's top international stories and headlines from around the globe, of course. So stay with us. Forum Daily will be right back after these messages.